When epilepsy is diagnosed and treatments commenced, unfortunately not everybody gets control of their illness or problems. Sometimes, in spite of the best attempts of their treating doctor, success isn't gained. In that situation, obtaining a further opinion makes sense. Sometimes patients see me for that reason and are a little bit surprised after I've assessed them that I suggest that they obtain a further opinion. Why would this be the case? One, it reflects the inherent complexity of many of the seizure disorders we encounter. Often people talk of epilepsy as it's simply a matter of seizures, but how seizures are generated within the brain, where they occur, how they respond to changes in lifestyle, in medication, and other treatments is variable from one person to another. Sometimes I struggle to diagnose accurately why epilepsies occurred in one patient and feel they would benefit from further investigations that can be conducted in other areas, and often feel that they would benefit from being assessed by a colleague who also has expertise in this area, simply from the advantage of having a second look at a complicated problem. From my perspective, there's only two results that can occur. Either the colleague gives similar advice that I've given to a patient, and that's reassuring to a patient that they have been progressing along a right therapeutic pathway. Or my colleague might come up with a different approach which will be of benefit to the patient, and to me personally, I'd rather see this achieved earlier and learn from errors I might have made. I think that most doctors take this approach, and so occasionally when a patient presents to me and says, "I've seen Dr. X and I'm not satisfied that we're making progress in my problem," I usually conclude our consultation saying, I would like to write to Dr. X to let him know what my thoughts are. I think this would be helpful in your management, as you may in fact wish to return to their care in the long term. Often the situation is that I often view the work that my colleague's done as being perfectly satisfactory. It just happens that if a doctor sees a patient further down the track of their illness, sometimes it becomes more obvious where success might be gained.